Prostate cancer, 10 early signs and symptoms. Hey everyone, Dr. Mike here. Did you know that 1 in 8 men will be diagnosed with prostate cancer in their lifetime? Recognizing the early signs can be life-saving. Knowledge is power, and today I'm empowering you with the knowledge to potentially catch prostate cancer early. So let's get right to it. The first sign we're going to talk about is difficulty urinating. Sure, as we age, things can change a bit, but there's a difference between normal aging and something more serious. We're talking about a weak urine stream, feeling like you haven't fully emptied your bladder or having to go more frequently, especially at night. Imagine this, you're constantly getting up to use the bathroom, disrupting your sleep and leaving you feeling tired throughout the day. Not fun, right? Now, this doesn't automatically mean you have prostate cancer, but it's a sign you shouldn't ignore. The prostate gland sits right below the bladder and surrounds the urethra, which is the tube that carries urine out of the body. As the prostate grows, it can squeeze the urethra, making it harder to pee. Think of it like this. Imagine your garden hose. If you pinch it, the water flow becomes weak and sputtering. So guys, if you're experiencing any kind of difficulty urinating, don't just brush it off as a normal part of aging. Talk to your doctor. The next warning sign is pain or a burning sensation during urination or ejaculation. This is not something you should ever ignore, guys. Think about the last time you had a cut or a burn. That stinging pain is your body's way of telling you something's wrong, right? Well, the same goes for pain or burning when you pee or ejaculate. This discomfort can be caused by a number of things, including urinary tract infections, inflammation, or even sexually transmitted infections. But it can also be a sign of prostate problems, including cancer. If you're experiencing this, I know it can be tempting to just tough it out and hope it goes away on its own. Remember, your health is your wealth. Don't hesitate to schedule that appointment with your doctor. They're there to help you get to the bottom of it and get you feeling better. Let's talk about a symptom that should always send you straight to the doctor: blood in your urine or semen. Seeing blood where it doesn't belong is never a good sign, and it's crucial to take it seriously. Imagine this, you're going about your day using the bathroom, and you notice your urine is pinkish or reddish. Or maybe you see streaks of blood in your semen. Guys, this is not normal, and it's not something you should ever ignore. While blood in the urine or semen can be caused by other factors like infections, kidney stones, or even strenuous exercise, it can also be a sign of a more serious underlying condition, including prostate cancer. Think of it like this. Your body is sending you a signal, a red flag that something is wrong. Ignoring this signal is like hitting the snooze button on your alarm clock when there's a fire. So, if you notice any blood in your urine or semen, don't wait, don't hesitate, don't brush it off. Pick up the phone and make that appointment. Persistent pain when your back, hips, or thighs are screaming for help. We all experience aches and pains from time to time, right? But what about persistent pain, especially in the lower back, hips, or thighs? This is different, and it's a sign you shouldn't ignore. Imagine this. You're trying to sleep, but the pain in your back is so bad you can barely find a comfortable position, or you're trying to enjoy a walk, but the nagging ache in your hips just won't quit. Now, while this pain can be caused by a number of things like muscle strain or arthritis, it can also be a sign that something more serious is going on, including prostate cancer that has spread. So if you're experiencing persistent pain in your lower back, hips, or thighs, especially if it's accompanied by other symptoms we've talked about, don't just reach for the painkillers and hope for the best. Talk to your doctor. Erectile dysfunction, a sensitive topic, but an important conversation. Let's talk about a topic that can be difficult for men to discuss. Erectile dysfunction. Imagine this. You're with your partner, the moment is right, but you're struggling to get or maintain an erection. It can be frustrating, embarrassing, and even impact your relationship. While erectile dysfunction can be caused by factors like stress, anxiety, medication side effects, or heart disease, it can also be a sign of prostate problems. If you're experiencing erectile dysfunction, don't suffer in silence. Talk to your doctor. They can help you determine the underlying cause and recommend the best course of treatment. Unexplained weight loss, when the scale moves in the wrong direction. Most of us wouldn't complain about losing a few pounds, right? But unexplained weight loss is different and shouldn't be ignored. Imagine eating normally, maybe even more than usual, but the pounds are dropping off without any effort. While it might seem like a good thing at first, unexplained weight loss is a sign that something isn't right. It can be caused by factors like hyperthyroidism, diabetes, or stress. But it can also be a sign of a more serious underlying condition, including cancer. If you're experiencing unexplained weight loss, especially if it's significant or accompanied by other symptoms we've talked about, don't just chalk it up to a change in your metabolism. Talk to your doctor. We all feel tired from time to time, especially in today's fast-paced world. But what about persistent fatigue or weakness that just doesn't seem to go away? That's different, and it's a sign you shouldn't ignore. Imagine this: you're waking up feeling exhausted even after a full night's sleep. Simple tasks that used to be easy now feel like a chore. While fatigue can be caused by a number of factors like stress, lack of sleep, poor diet, or even certain medications, it can also be a sign of a more serious underlying condition. So if you're experiencing persistent fatigue or weakness, especially if it's accompanied by other symptoms we've talked about, don't just try to push through it. Talk to your doctor. They can help you determine the underlying cause and get you back to feeling energized and revitalized. Swelling in your legs and feet can be normal after a long day of standing or sitting, especially in hot weather. But persistent swelling that doesn't go away is different and shouldn't be ignored. Imagine taking off your shoes and socks at the end of the day and noticing your ankles and feet are puffy and swollen. Swelling in the legs and feet can be caused by circulatory problems, kidney issues, or certain medications, but it can also indicate a more serious condition. If you're experiencing persistent swelling in your legs and feet, especially with other symptoms, don't just elevate your feet and hope for the best. Talk to your doctor. They can help determine the underlying cause and get you back on track. Let's talk about a symptom that can be particularly distressing: loss of bladder or bowel control. Imagine this. You're going about your day, and you suddenly feel a strong urge to urinate or defecate that you can't control. This can be embarrassing, isolating, and have a significant impact on your quality of life. While loss of bladder or bowel control can be caused by a number of factors like nerve damage, muscle weakness, or even certain medications, it can also be a sign of a more serious underlying condition, including prostate cancer that has spread. So if you're experiencing loss of bladder or bowel control, don't suffer in silence. Talk to your doctor. They can help you determine the underlying cause and recommend the best course of treatment. We've covered a lot of ground today, and I know it can be overwhelming. When it comes to your health, knowledge is power, and listening to your body is crucial. You know your body better than anyone else, and if something feels off, don't ignore it. Early detection is key when it comes to most health conditions, and prostate cancer is no exception. Just like you wouldn't wait for your car to break down before taking it in, you shouldn't wait for your body to give you major warning signs before seeing your doctor. If you're experiencing any unusual changes in your urinary or sexual health, don't hesitate to talk to your doctor. They are there to listen to your concerns, answer your questions, and help you make informed decisions about your health. Guys, we've covered a lot today. We talked about the importance of recognizing the early warning signs of prostate cancer, and I hope you found this information helpful. Remember, if you notice any of these signs, schedule an appointment with your healthcare provider immediately. Early detection is key, and it all starts with being proactive about your health. Talk to your doctor about prostate cancer screening, including the PSA, prostate-specific antigen test, and the digital rectal exam, DRE. These screenings can help detect prostate cancer early when it's most treatable. Stay informed, stay proactive, and take charge of your health. Until next time, stay healthy, my friends. Knowledge is power, and early action can make all the difference.